the patient got through and had a partial response. That's typical. Now, I always caution patients with regard to that first CT scan, because the first thing patients want to know after completing chemoradiation is, did it work? I counsel them to say, well, in that first CT scan, actually, the CT scan is going to be hard to interpret because we see a lot of changes as a result of the radiation. So you can't be certain. You can suspect that much of what you may see on the CT scan may be the result of the radiation and not the cancer. I saw a patient this week in my practice who finished his chemoradiation about 3 weeks ago, had a CAT scan about 3 or 4 days ago. I saw him yesterday in my practice, and I reviewed his CT scan for him. And his cancer, where I knew his cancer was actually looked better, but around the cancer in the field of radiation, he had many nodules that were there that I don't think are related to the cancer. I think they're a result of the radiation. I think with time, as we see with most radiation changes, they resolve or improve over time. So I was very confident that this patient did not have evidence of disease progression. But that's observation based on 25 years of experience in treating these patients and looking at CT scans in these stage 3 patients as a result of radiation and kind of making that judgment call. With regard to follow-up and evaluation of this patient, I can tell you that prior to the Pacific data, what I would typically do, as I mentioned before, radiation can cause changes in the CAT scan. So I would wait 2 months to get the first CT scan following completion of chemoradiotherapy. If that scan looked okay, I would do another scan at 6 months. If that scan looked okay, I would do another scan at 1 year. There are no specific guidelines with regard to surveillance. I would avoid doing PET scans in these patients. And that's typically what I would do prior to the Pacific data. Now, the Pacific data changed that, because what the Pacific trial did is really mandate that patients receive durvalumab within 6 weeks of treatment. And it also demanded that patients had evidence of no disease progression. So you had to do a CT scan to make sure that the cancer wasn't worse. And you had to do that within 6 weeks, or I would argue within 4 weeks or 2 weeks or whatever, because it does take some time to get the drug authorized and get the patient scheduled for the infusion and all those sorts of things. We want to start them on immunotherapy before 6 weeks. So getting a CT scheduled, getting it read and evaluated, seeing the physician, getting the drug authorized and getting the infusion scheduled, you have to account that that's a 2-week process. So really, all things being equal, because of the Pacific trial, my practice has changed from doing a CT at 2 months to doing a CT between 2 and 4 weeks following completion of chemoradiotherapy.